The University of Cincinnati Cancer Center is the future of cancer care. We're here with Dr. Ed Faber, a blood cancer physician, to talk about this new facility. It's really changing the way that you're working. Tell me a little bit about this new space and what this is doing for patients, for doctors, for everyone working here.
Yeah, the building is a realization of a dream started 3 or more years ago. So it's been great to see the transformation from the Children's Shriners Hospital to what we see today. Warm colors, it's relaxing, it's very calming, unlike sometimes the hustle and bustle that we see every day in our clinics, in the waiting room and waiting for your treatments and your therapy and your labs and so forth. But if we think about this building will transform cancer care. Not because the specifics are different, many great centers have them all, but they don't have them all under one roof. So clinical care, research, survivorship, integrative medicine, and spirituality, every day 24/7 under one roof for patients and our staff.
And you were really telling me about the community that's formed by that, by being able to have access to, you said, patients to relate to each other, to have all of the different people who are taking care of them in one space.
Yeah, absolutely. So your day-to-day here, from the time you get into work and maybe the time you leave, and our patients when they arrive for their care and when they decide that they're finished and leave, that whole experience does create a community. We want people to gain hope and inspiration from each other. Maybe a patient that is newly diagnosed and unfamiliar and unaware, because let's be honest, cancer is scary and we lose control in just about every part of our lives for a while. But we want them to pass by, say, another patient in the waiting room or in the treatment center that has been where they have been maybe a year ago, 3 years ago, 5 years ago. And we want people to gain hope from that.
My first day here, I got in my room and Dr. Bird came in, and as Dr. Bird was speaking to me, he let me know that, I was their very first patient with acute kidney failure, and they couldn't promise me anything, so I had 2 to 3 months to live. And so with that, I was, your whole world just stops. And so it was hard, but I decided that this would be a trial. They couldn't promise me anything, but I had the treatment, and like I said, during that 14 days here, they were on top of me. They did what they needed to do. I did the clistamab and the treatments that they had you do. And I walked out in 14 days. So I'm very blessed.
Tell me about that experience of being a patient of Dr. Faber's.
Dr. Faber and his staff, I'm telling you, they are very passionate. They are very clear, they're professional. They answered any questions I had. They let me know exactly what I was going into, and even up to this day, they're very clear with everything. They're wonderful.
Dr. Faber, tell me about some of those outcomes, the survival outcomes of your patients, their ability to really live with a high quality of life here.
The one outcome we're especially proud of is with our acute leukemia survival. We are more than 30% better than the national averages as it relates to how we choose care and how we target care to individualized patients. And I know all of us were very proud to be a very small part in a much greater good.